The practical work in the discipline of infectious diseases and preventive medicine is based on all the knowledge you have already acquired in the preclinical disciplines, and makes a correlation of this necessary information in order to understand and not memorize these diseases. Warning to users, students. All documents placed in open access on the site, the faculty site, and presented, are protected by copyright. In accordance with the principles set out by the Budapest Open Access Initiative, BOI, 2002, the user of the site may read, download, copy, transmit, print, search or link to the full text of these documents, dissect them for them, index, use data for software, or use it for any other legal or copyright purpose. Any use of the document for commercial purposes is strictly prohibited. In addition, the user agrees to respect the moral rights of the author, mainly the right to the integrity of the work and the right of paternity, and this in any use that the user undertakes. Thus, by way of example, when reproducing a document by extract or in its entirety, the user will fully cite the sources as mentioned above. Any use not explicitly authorized above, such as, for example, the modification of the document or its summary, requires the prior and express authorization of the authors or their successors in title. Notifications of labor protection, fire prevention, and extinguishing. Entering the laboratories and classrooms is done in an organized manner, with the appropriate protective equipment, gown, cap, protective gloves, apron. The laboratory equipment is handled only with the approval and in the presence of the teaching staff. Students will not walk to the electricity and methane gas installation. Food and drinks of any kind are not consumed in the workspaces, laboratories, necropsy rooms. Smoking is prohibited in public spaces, halls, hallways, restrooms. The handling of any material and biological preparation is done only under the supervision of the teaching staff. It is forbidden to remove the pathological material from the workspaces. The activities during the practical work and the class hours as well as during the breaks must comply with the norms of university ethics and deontology. The students will examine the animals in compliance with the restraint rules specified in semiology only in the presence of the teaching staff. During the trip to the farms and the teaching station, the consumption of alcoholic beverages and smoking are prohibited. During the activities carried out on the farms and the didactic station as well as in the university hospital, the rules of labor protection and PESI will be respected. Provided for each individual objective. Any deviation from the rules of labor protection and PESI, as well as from the obligations and duties of the students stipulated in the university charter, will be sanctioned according to the laws in force by the legal bodies.
Purpose of practical works: establishing the diagnosis of suspicion and confirmation in infectious diseases, and based on the confirmation, the establishment of prophylaxis, monitoring and control measures. Uncontrolled disruption of one or more functions of an organism, with or without clinical lesion expression, as a result of body penetration of a foreign entity capable of multiplying and giving birth to identical entities. Within the suspicion assumption mandatory diagnosis, three large groups of investigations are described: epidemiological, clinical, anatomopathological. As part of the confirmation certainty diagnosis, a sufficient number of confirmation examinations necessary for the identification of the antigen or antibodies must be performed. Sometimes a single examination is sufficient, in order to finally pronounce a positive or negative result. At this stage, depending on the suspicion, additional examinations are performed. Bacterioscopical, bacteriological, virological, serological, histopathological, biological bioprobe. Conclusion: the diagnosis of an infectious disease is made by isolating and identifying the pathogen involved, the antigen, as well as the immunological traces of its passage through or in contact with the body antibodies. Epidemiological diagnosis: it studies the origin, evolution and extinction of mass morbid processes. Work instrument: epidemiological inquiry. It is mandatory when you suspect an infectious disease. Epidemiological inquiry: it is defined as a complex of investigations aimed to determining the conditions in which the disease occurred, the source of the pathogen, transmission ways, factors that favored the occurrence of the disease, the extension of the disease, Other data necessary for the development of the disease control program. Working methods. Collecting anamnetic data. Investigation of the veterinary sanitary records. Examination of the outbreak. At the end of the epidemiological investigation, it must be established. Date of the disease occurrence and if it was announced from the first suspicion. Clinical and anatomopathological aspects that created the suspicion of disease as well as subsequent investigations required to confirm the disease. Degree of the disease expansion into a territory. Species and animals categories affected. Number of sick or suspected to be contaminated cases. Origin and pathways for the introduction of the disease, endogenous or exogenous. Establishment of suspected contamination areas by the disease outbreak studied, through vehicles, humans, objects or animals. Identifying the favoring factors of the onset, occurrence, and evolution of the disease. Other specific local issues related to the occurrence of the disease. Sources of infection primary sources. Allow multiplication of the pathogen. Living receptive organisms to the disease. Without sensitivity. With sensitivity reduced by vaccination. Sensitive. Carcasses of dead animals. Animal products. Sources of infection secondary sources. Are only support for the pathogens. Outdoor environment, fixed supports, soil, meadows, roads, buildings, inventory items, stalls, gullies, tools. Mobile supports, water, air, aerosols, vehicles, humans, domestic and wild animals. Living receptive organisms, without sensitivity allows the development of the pathogen up to a certain level, but without expressing the symptomatology. Epidemiological importance. Number of pathogens per individual versus number of individuals per population. Maintain the disease into the flock. Living receptive organisms, organisms with sensitivity to the disease but reduced by vaccination. In general, vaccination protects animals and does not allow the development of targeted pathogen in the animal. Vaccination protects the animals from the clinical expression of the disease but not from an infection. Vaccination suppresses sensitivity but not receptivity. A vaccinated flock can be infected in a silent manner, the infection being detectable only at the individuals who have not been vaccinated. Living receptive organisms, sensitive organisms with clinical signs of the disease. Can eliminate infectious agents in different phases of the disease evolution. Incubation. Clinical expression. Convalescence. Carcasses of dead animals. Frequent are sources of infection. Destruction. The carcasses of the dead animals is one of the most important ways of fight and eradication of infectious diseases. If additional examinations are required, all necessary measures are taken, nonspecific and specific, to avoid the release of the pathogen. Products of animal origin. Sources of this products are usually clinically healthy animals. Products from diseased animals are banned from consumption based on the sanitary examination or are directed to be used after conditioning by heat. The carrier source of pathogens, in association with inappropriate processing in kitchens or public catering establishments, will allow the pathogen replication, and collective food poisoning. Survival time of the pathogen will determine the infectivity period of the products. Environmental factors with inactivation properties action like UV light, heat, dryness, dampness, will give progressive reduction of infectious units. Receptivity of organisms. The receptivity of organisms is influenced by a series of determining and favoring factors. The determining factors, intrinsic or inborn, are dependent on the body and cannot be modified: species, race, age, sex, individual. Extrinsical are those external to the body, and at this level you can act to interrupt the epidemiological chain: pathogens, shelter, food, exploitation system, caregiver. Favorable factors are represented by those elements that help the major factors of receptivity in the expression of the disease, but which alone cannot trigger the morbid process. Transmission ways. Direct, through direct contact with the organism which spread the pathogen. Horizontal, transcutaneous and mucosal route, digestive, respiratory, conjunctivitis, genital. Vertical, from mother to baby animal, hen embryo. Indirect, by indirect contact. contaminated food, water, air, vehicles, humans and non-receptive animals. Epidemiological dynamics. Disease evolution in population, time, space. Sporadic disease that evolves with isolated cases in a herd, in an indefinite period of time, usually in certain small areas and in certain environmental conditions. These cases appear to be unrelated to each other. Enzootic disease with slow evolution, months, years in the herd, involving a small number of animals, without a tendency to spread outside the outbreak farm and with a trailing character in the herd. Epizootic, a disease involving a large number of animals in a relatively short time with a tendency to spread outside the herd, including several neighboring farms, in a short period of time, on geographical areas as large as counties or provinces. Penzootic disease with very rapid evolution, days, including in a relatively short time a large number of animals, or species, on large areas such as countries or continents. COVID, FMD example. Enzootic dynamics is a particular case of enzootic evolution in which, based on the epidemiological investigation, the evolution of the disease is found in a large number of animals, within a farm, in a relatively short time, but which recognizes a single source of infection, for example poisoning with botulinum toxin. Measures prior to clinical examination. Ensuring labor protection measures, protective equipment, boots, gown, gloves, hand washing and disinfection. Training of support staff. The examination is done in the presence of the owner or the caregiver. The examiner will determine the approach plan and contention as well as the examination plan. General examination methods. Inspection, palpation, percussion, listening, thermometry. Special methods, complementary physical, measurements, some laboratory exams, VSH endoscopic, ultrasound, radiological, scraping, surveys, biochemical and hematological, qualitative and quantitative, biological. Anatomopathological examination. Following the anatomopathological examination, common data are obtained. Can be nonspecific injuries, refers only to the main types of diseases. Characteristic lesions for an organ, points to a group of diseases. Pathognomonic lesions, Babes negri corpuscles. Conditions for performing an accurate anatomopathological examination. To be executed immediately after death or slaughter in specially arranged places in compliance with labor protection measures. The necropsy technique involves informative stage, descriptive stage, external examination of the corpse, internal examination of the corpse, external examination of the corpse, assessing the state of maintenance. The external appearance, cadaveric changes, skin, mucous membranes, natural openings, horns, hooves, hair. Positioning and skinning will be performed before the internal examination. Large animals. Position suspended from the rear train. Left or right dorsolateral position with the opposite bipeds suspended. Medium and small animals are usually positioned dorsally, tying the limbs to the necropsy table or tray if possible. Skinning is not done in animals suspected of anthrax, rabies or snort and is more difficult in pigs due to adipose tissue. Skinning involves making several lines of incision. A line joining the pubis with the anterior extremity of the mandible passing along the white line, two lines perpendicular to it that join the metacarpal regions and respectively metatarsals of the limbs, on their internal face. Internal examination of the corpse. The evisceration. The opening order of the cavities, 1. Pelvico-abdominal 2. Thoracic 3. Pericardial 4. Head cavities. A buttonhole is made at the level of the white line. It is examined through the buttonhole. If there are collections at this level, it is collected, examined to establish its nature. The incision is continued up to the xiphoid appendix and then on either side of the hypochondrium. Opening the chest cavity can be done in several ways. Large animals suspended from the rear train by cutting the diaphragm. Dorsolateral decubitus by cutting the opposite hemithorax, only the first and last ribs are left in the anatomical position. Small animals supine by raising the sternal-plastron, sectioning the sternocostal joints, or by raising the sternum and ribcage, sectioning the ribs as close as possible to the spine. Evisceration of small animals done en bloc, all organs are removed in one piece. Evisceration of large animals performed on anatomical parts. Oral cervical thoracic piece. Stomach and spleen, before they are removed, the permeability of the choledochal canal is tested. The greater mesentery, the duodenum, the jejunum, and the ileum. The small mesentery, and the large intestine as a whole. Liver. The kidneys and ureters remain attached to the abdominal cavity. They are removed only if changes are necessary, in order to do additional examinations, including the renal decapsulation test. Anatomopathological examination in birds. A buttonhole is performed behind the xiphoid appendix, continuing with an incision line. The ribs, coracoid processes and clavicular branch are sectioned, including the muscular structure. The sternal plastron is removed by bending it forward. A first inspection of the organs in the pericardial cavity is done. The evisceration. Heart and liver. Esophagus, proventriculus, ventricle, duodenum and pancreas. Spleen. The intestinal mass, the cloaca, the anal orifice, and the oviduct. In the thoracoabdominal cavity remain the lungs, ovary or testicles and kidneys, which are extracted only if they are modified. Harvesting, packaging and shipping pathological material. Harvesting must comply with a number of general rules. Collected samples must be representative for the respective pathological process. Representativeness. Sufficient amount of pathological material is collected, sufficiency, to allow complete laboratory analyses. Avoiding sample contamination, sterile instruments, compliance with asepsis rules. Harvesting is done only from fresh corpses. Samples for the bacteriological examination must come from animals that have not been treated with antibiotics, otherwise it is specified in the accompanying note which antibiotics were used, which other treatments were carried out and on what date. Samples are kept in a refrigerator, 2 to 8 degrees Celsius, until shipping. Samples collected for bacteriological and virological examinations, sick or alive animals. Whole carcasses of birds and small animals, in bags soaked with 3% tannic acid or 1% sublimate. Whole organs or parts of organs, long bone with unopened marrow. Pathological fluids, secretions, excretions, pus, blood or organ smears. For the biological sample in the bacteriological examination, the same measures specified above, and for virology, blood, pathological humors are collected in a thermos with ice or 50% glycerin. For the histopathological examination, 5 to 10 mm slices of the organ are collected in a 10% formalin solution. Samples transportation. The corpses are packed in plastic bags that are placed in wooden boxes with sawdust. Whole organs and parts of organs, if they are rich in liquids, are packed in plastic bags that are later placed in hermetically sealed plastic or glass containers. If they are poor in liquids, they will be wrapped in parchment paper. Smears are wrapped 2 by 2 with the side used for performing the smear on the outside. The wrapping is done in paper. Dispatch. Shipping is done with 1. Official address and 2. Accompanying note completed and signed by the veterinarian.